by our Chairman Medical, Dr. K Viswanath.
Good evening, ladies and gentlemen. Respected Chief Guest of the function, Sri Honorable Justice Subhashan Reddy Garu. The recipient of Foundation Day Award, Honorable Dr. Nampak Swami. Probably we have emulated from the Arvind eye care system and I am trying to do the best. My colleague Chairman, Govind Hari, my board of directors, fellow ophthalmologists, friends, well-wishers. It gives me great pleasure in presenting you some of the achievements we had in the last 2.5 years of our working at the Pushpagiri Eye Institute. We have a very strong board with the most able people like Govind Hari, Muralidhar, Nandkishore, Prakash Rao, Mahavishnu, who have been introduced to you just now. And then we have the blessings of the Swamiji, Sri Abhinavanath Danda, Vidya Narasimha Bharati, is the chief patron, is the presiding Swamiji of the Pushpagiri Mahasamsthanam. We also have the blessings of the Lord Chandramoulishwara with us. PVRA philosophy, as we all know, that we need to have a prevention and cure, but at the same time we need to look at the super specialty state of art of eye care, making it available to everyone. So, though we started with the diabetic retinopathy and the cause of blindness due to diabetes as the main focus in the beginning, soon we realized it and then we started to establish a super specialty eye care to look at all the causes of the blindness. We believe in maximum outreach service, and also we are trying to develop a regular follow-up. We all know that the diabetic retinopathy, even screened once and then treated once, requires a lifetime follow-up. So we are looking for a regular follow-up model, and then if everything goes in place, we should be able to adopt one of the districts and then emulate a model to suit our Indian conditions to look at the diabetic blindness. We also believe that we need to continuously train or retrain ourselves by continuing medical education, and we invite the specialists in involving this continuing medical education program. Human resource development has the need of the hour. We require lots of medical retinal specialists. I am sure you heard Taraprasad talking about the training program. We just started our fellowship program, Vitreoretinal Fellowship Program, and we have a fellow working with us today. We also believe in the IEC activities and propagating the need for prevention of the blindness. We have a very transparent board, so that I am very happy that everything goes in black and white and then highly transparent. We are also trying to sustain the quality management, as you just heard my colleague Lokaviredi talking to you about what we are trying to do. We have all the specialty eye care services, and then including the ROP screening program with the association of 3 child specialty hospitals where there is a care for neonatal intensive care units like Basant Sahani Hospital, Hope Child Hospital, and Aditya and Rainbow Child Hospitals. As we all just heard that diabetes requires special attention, we have been conducting the community screening camps, and then which also where we try to educate the patient in the need for the lifetime follow-up. The typical camp routine we register, we have a time-tested pro forma wherein we fill in the details of the patient right from the demographic data to the details about the disease in the way it is being controlled or not being controlled, the care of physician, everything is being recorded. And the patient will be screened after taking the intraocular pressure, dilating the fundus, and then we actually use a handheld slit lamp and then check the anterior segment before dilatation and then check the fundus, also deliver the, if necessary, a one setting of laser treatment by our portable laser. In fact, we could conduct about 24 diabetic retinopathy screening camps so far. That's how the screening camps at various places like Karnool, Tirumala Tirupati Devasthanam and many other places. We also look at the corneal blindness with our Madhava Netranidhi Cornea Collection Center. This has been established with the support of the Madhava we have collected about 30 eyes and then performed 65 corneal grafting surgeries. With 38, it doesn't mean that we have done 65. We collect eyes, we collect the corneas from our friendly neighborhood banks like Ramayama Eye Bank and Chiranjeevi Eye Bank. Whenever we have nail surgeon, Dr. Rishi Swarup, attending the corneal grafting surgery, he conducts a clinic on every Saturday with our institute. We also believe that doing service is enough. We need to have research, academic research into the various aspects of the eye diseases. We have an ethics committee comprised of honorable members who from the various sectors of life like a retired accountant general, a lawyer, a school teacher and a virology specialist and a medical specialist, which is necessary for an ethics committee, institutional review board, and then they always look at our research protocols. We did conduct a study on the micronutrients as Mr. Govind was trying to tell you, and the part of the activity has been reported in the recent Asia. We continue to do that research activity. As I told you, we have established 2 fellowship programs, one in comprehensive ophthalmology and a vitreoretinal disease management program, which is a 15-month fellowship program. The academic activities, we do involve our local friends, colleagues, specialists in the continuing medical education activity, and all those who have helped us in conducting the continuing medical education program. We have a partnership with 2 major eye institutes of the Andhra Pradesh. One is Sri Kiran Eye Institute at Kakinada, another is R.R. Lyons Hospital at Palkol, West Godavari, where we conduct and Aluri Hospital at Ongole. Every month, 1 day vitreoretinal services for them. They have bought the equipment, our specialists go there, see the patients, perform the surgeries at Kakinada where they have the facility, and then follow-up is done by the local ophthalmologist. Then, if necessary, some of the cases are being asked to come to the Pushpagiri Institute for other advanced vitreoretinal surgeries. The Eye Institute is proud to have the accreditations of all the possible services schemes like central government health scheme, the state government referral hospital for special treatment for all their employees and retired and pensioners. It's been empaneled as the Specialty Eye Care Hospital for Arogyasri scheme. Statewide recognition as a base hospital. District Blindness Control Societies have recognized us. The ESI Corporation, Finger and National Institute of Nutrition have empaneled as their Specialty Eye Care Hospital. We also had the opportunity and the good friendship of the friends from our USA from establishing the Indo-American Eye Care Organization at Detroit, and then this is helping us to raise funds from our NRA friends. I'm happy to announce that we will have a fundraiser in Denver in October 2009. I request our friends, well-wishers here, if you have your NRA relatives, friends, you can ask them to join in the fundraiser program in October 2009. As far as the achievements are concerned, I am sure the simple statistics, and I am proud to say that we have been given the opportunity to serve all patients referred by all of you to the utmost satisfaction of you and as well as the patients. I wish you would express if there is anything which has not been to the satisfaction of your patients, to kindly write us back so that we will be able to take care of your patients in a better fashion in the future. At the inception of the Arogyasri Health Scheme, we started in September 2008. We have been loaded, actually flooded with eye patients, and it's an eye-opener for us because there are so many patients waiting for the keratoplasties for the lack of infrastructure, lack of facility, affordability, and then they're all clogging the beds, and the beds are full with Arogyasri patients. And then it's also an eye-opener that there are so many pediatric cataracts lying in the remote places of Andhra Pradesh where they could not afford to get it operated. In fact, my comprehensive surgeon, Dr. Krishnan Raju, felt so immensely happy the other day when he has operated on a 10-year-old boy. After the surgery, he has been running around the hospital, and then he took pictures along